1. What is the primary goal of case management? A. Reduce healthcare costs. B. Provide psychotherapy. C. Ensure timely access to appropriate care. D. Advocate for the insurance company. 2. The best example of a measurable patient outcome is patient satisfaction. B. Patient feels better. C. Patient walks 100 feet unassisted within 1 week. D. Patient reports improved mood. 3. A bundle payment system refers to A. Charging patients a monthly fee. B. A single payment for all services in an episode of care. C. Paying providers separately for each service. D. Discounted billing for low-income patients. 4. Which entity typically manages Medicare Advantage plans? A. CMS directly. B. State Medicaid agencies. C. Private insurance companies. D. Veterans Affairs. 5. The patient-centered medical home PCMH model emphasizes A. Hospital-based acute care. B. Specialist referrals. C. Coordinated primary care. D. Emergency room visits. 6. A case manager working with a homeless patient with schizophrenia should first A. Refer to inpatient rehab. B. Arrange for housing and psychiatric care. C. Call adult protective services. D. Place in a nursing home. 7. Motivational interviewing is a technique used to A. Persuade patients to take medication. B. Explore and resolve ambivalence. C. Diagnose psychological disorders. D. Confront patient denial. 8. Which theory focuses on meeting a hierarchy of needs from survival to self-actualization? A. Erikson's theory. B. Piaget's theory. C. Maslow's hierarchy. D. Freud's theory. 9. A patient recently diagnosed with cancer is in the bargaining stage of grief. What is a typical statement? A. This can't be happening to me. B. If I do everything right, maybe it will go away. C. I'm going to die soon anyway. D. I accept what's happening. 10. What is the most effective approach when managing cultural differences in care planning? A. Follow standard protocols. B. Refer to clergy. C. Involve culturally appropriate resources and communication. D. Rely on the physician. 11. Which part of Medicare covers inpatient hospital care? A. Part A, B. Part B, C. Part C, D. Part D. 12. What is the purpose of a utilization review? A. To assess patient satisfaction. B. To determine if care is medically necessary. C. To calculate insurance premiums. D. To identify social support needs. 13. Which is not a feature of managed care organizations' MCOs? A. Capitated payment model. B. Fee-for-service reimbursement. C. Emphasis on prevention. D. Pre-authorization requirements. 14. The role of the case manager in discharge planning includes A. Prescribing medications. B. Performing physical therapy. C. Coordinating care transitions and follow-up services. D. Diagnosing medical conditions. 15. Which government program covers low-income individuals and is state-administered? A. Medicare. B. TRICARE. C. Medicaid. D. COBRA. 16. What is the best definition of informed consent? A. A legal form signed by a doctor. B. A patient's agreement after understanding treatment risks and benefits. C. A verbal agreement to any treatment. D. Permission given under duress. 17. HIPAA primarily ensures A. Lower premiums. B. Coverage for all Americans. C. Privacy of health information. D. Automatic Medicare eligibility. 18. A case manager suspects elder abuse. What is the correct action? A. Document and continue monitoring. B. Report immediately to Adult Protective Services. C. Notify the patient's family. D. Wait for confirmation from a physician. 19. The ethical principle of autonomy involves A. Promoting the greatest good. B. Doing no harm. C. Respecting patient decision-making. D. Acting in the best interest of the patient without input. 20. Conflict of interest occurs when A. A patient declines a recommendation. B. A case manager receives a gift from a vendor. C. Providers disagree on treatment. D. Insurance denies coverage. 21. What is the main goal of vocational rehabilitation? A. Teach daily living skills. B. Maximize functional independence. C. Assist individuals in returning to work. D. Provide permanent disability benefits. 22. The Americans with Disabilities Act ADA prohibits discrimination in A. Private clubs. B. Foreign workplaces. C. Employment and public accommodations. D. Medicare enrollment. 23. Functional capacity evaluation FCE is used to A. Determine psychiatric stability. B. Assess ability to perform work tasks. C. Evaluate family dynamics. D. Decide insurance coverage. 24. A spinal cord injury patient is being discharged home. What is most important? A. Referral for psychotherapy. B. Evaluation of home for accessibility and support needs. C. Teaching about disease process. D. Assigning a new primary care doctor. 25. What is the difference between temporary total and permanent partial disability? A. One is physical and one is psychological. B. Temporary total refers to full incapacity for a limited time. C. Permanent partial requires hospitalization. D. There is no difference. Commission for Case Manager Certification. The Commission for Case Manager Certification CCMC test, known as the Certified Case Manager CCM exam, is a comprehensive, competency-based assessment designed for healthcare professionals pursuing certification in case management. It evaluates a candidate's knowledge and skills across key domains such as care coordination, healthcare reimbursement, legal and ethical considerations, and psychosocial aspects of care. The exam ensures that case managers are equipped to deliver client-centered services, advocate for quality and cost-effective outcomes, and collaborate across multidisciplinary teams. Earning the CCM credential demonstrates a high standard of professional practice, enhances career opportunities, and validates expertise in managing complex care transitions in diverse healthcare settings. Here are the top 5 beneficial uses of the sample exam. 1. Validates professional competency. The CCM exam demonstrates that a case manager possesses the essential knowledge and skills to perform effectively across healthcare settings, including care coordination, advocacy, and resource management. 2. Enhances career advancement. Earning the CCM credential increases job marketability, opens up leadership opportunities, and often results in higher compensation for certified professionals. 3. Establishes credibility and trust. Certification builds credibility among colleagues, patients, and employers, reinforcing a commitment to ethical standards and best practices in case management. 4. Improves quality of care delivery. Certified case managers are trained to deliver evidence-based, patient-centered care that improves outcomes and reduces readmissions. 5. Supports professional growth. The certification process encourages continuous learning and professional development, keeping practitioners up to date with industry changes and healthcare regulations.